Hello everyone, my name is Hayden Porter and today I'll be presenting a comparison of the healthcare systems of the United States and Switzerland. Both rely heavily on private insurance, but their outcomes and approaches are very different, and my goal today is to highlight the strengths and weaknesses of each system and to discuss what lessons the US might be able to take from Switzerland. Healthcare comparisons are important because they help us understand not only how different countries approach the same problem, but also how effective those approaches are. In this presentation, I'll provide an overview of both the US and Swiss healthcare systems, compare them across key areas such as cost, access, and outcomes, and then offer my own perspective on what the US could learn from Switzerland. Slide. Now, their historical background. The history of each system explains why they look so different today. In the United States, employer-based health insurance became dominant after World War II, and then the country never adopted universal health care. In contrast, Switzerland passed the Lamal Law in 1994, which made health insurance mandatory for every resident. That law created the framework for today's Swiss system, where everyone must buy coverage, but no one is left out. Now, for the U.S. healthcare overview. The U.S. healthcare system is a complex mix of private and public programs. Most working adults get insurance through their employers. Some adults and low-income groups rely on Medicare and Medicaid. Millions of Americans also purchase insurance through the Affordable Care Act marketplaces. However, even with these programs, the U.S. still lacks universal coverage and has one of the most fragmented systems in the world. Now, for the challenges in the U.S., the challenges are significant. The U.S. spends over $12,000 per year on healthcare. The U.S. spends over $12,000 per person per year on healthcare, the highest in the world. Yet, more than 27 million people remain uninsured. The system also produces major health disparities, with outcomes that are not always better than countries that spend far, far less. These facts raise questions about efficiency and equity in American healthcare. Now, for Switzerland's overview, Switzerland, on the other hand, ensures universal healthcare through a private model. Every resident is required by law to purchase healthcare or to purchase health insurance. Insurance are private, but they must provide a standard package of basic benefits, and they cannot make a profit from those basic services. The government plays a strong regulatory role in ensuring fairness and affordability. Now, for the financing models, the financing of these systems is also very different. In the United States, funding comes from a combination of private insurance, government programs, and out-of-pocket payments, which creates complexity and inequality, and in Switzerland, everyone pays premiums directly to private insurers. However, the government provides subsidies to low-income individuals, and regulation keeps insurers from overcharging. This ensures that no one is left out without coverage. Now, for the role of the government, one big difference is the role of the government is in the U.S. Government involvement is limited to specific programs like Medicare and Medicaid, and regulations are weaker overall. In Switzerland, government plays a stronger role by regulating insurers, enforcing mandatory coverage, and providing subsidies for those who cannot afford premiums. Now, for the strengths of Switzerland's system, Switzerland model has several strengths. First, it provides universal coverage, meaning no one is left out. Second, competition amongst insurers encourages efficiency. Third, administrative costs are lower compared to the U.S. And finally, the surveys show that Swiss citizens are genuinely very satisfied with their healthcare systems. These outcomes show that the universal healthcare coverage can be achieved without government-run insurance. Now, for the cost access in comparison, when we compare cost and access, the difference are striking. The U.S. spends far more per person than Switzerland, yet leaves millions uninsured. Switzerland does spend more than many European countries, but it still ensures universal access. Out-of-pocket costs are capped so that people don't go bankrupt because of medical bills. Something like that happens far too often in the U.S. And for the health outcome comparisons, the difference in outcomes are also clear. Life expectancy in Switzerland is around 84 years compared to just 77 in the US. Infant mortality is lower in Switzerland and preventative care is stronger. Overall, Switzerland consistently ranks higher on international health indicators despite spending less than the United States. Now for the patient experience, both systems have strengths and weaknesses, and in the US, insured patients often have quick access to specialists and advanced care, but many face financial stress. In Switzerland, wait times are relatively short and satisfaction levels are high, but some families still feel burdened by cost sharing despite universal coverage. In my view, Switzerland strikes a good balance between private choice and universal access. The US could adopt stricter regulations on insurance companies and require universal participation, which would help address the issues of inequality. At the same time, I recognize that the cultural and political difference make it challenging for the US to move in this direction. Still, the Swiss model demonstrates that it is possible to combine market competition with fairness and equity. Now for the policy lessons and challenges, there are important lessons and challenges to consider. From Switzerland, the US could learn the value of universal mandates, subsidies for lower income groups, and strong price regulation. However, Switzerland also faces challenges. That is one of the most costly systems in Europe. For the US, the biggest obstacle is political, since major reforms are often resisted by powerful stakeholders. Now for the conclude, the U.S. healthcare system is marked by high costs, unequal access, and average outcomes, while Switzerland ensures that universal coverage through and regulated private-based systems that provide better results. Both systems have strengths and weaknesses, but the U.S. could certainly learn from Switzerland's emphasis on fairness, efficiency, and universal access. So essentially, the U.S. could learn some things from Switzerland, and Switzerland could learn some things from the U.S. Thank you for listening, and now let's look at the references. These are my references. Main sources I used, including data from WHO, the World Health Organization, OECD, health statistics, and reports from Commonwealth Fund, and the U.S. Census Bureau (CMS) data. Thank you for your time, and have a good one.